Hello, everybody. We'd like to invite you into our home and to experience a day in the life of Dr. Alex and Mikele Earle. So, a typical day in the life of Dr. Alex Earle starts at actually 4:52 a.m. I actually put my alarm 8 minutes fast so that when it goes off at 5, I don't feel like I'm waking up before 5. But I get up at 4:52, get ready. I'm out the door usually within 20 minutes. I'm in the office by about 5:30 or so, at the same time as the first patient is arriving. So I often get asked where I'm from and why, my last name's Earle, but I speak English, I speak Spanish. For me, it's actually not quite that straightforward. We used to move around a lot when I was a kid. I was actually born in Panama. From there, we were in Costa Rica, we're in Miami, Uruguay, Ecuador, and finally we settled down in Puerto Rico. So if someone asks me that question and they don't have a lot of time, then I would say I'm from Puerto Rico. But if they do have the time, then I say I'm international. I like to say that my formative years were in Puerto Rico, so I did all my high school there. And that's really where I really got into riding. I did equestrian show jumping, and I spent a lot of time training and competing both in Puerto Rico as well as the US and Canada and internationally as well. At one point, I even probably considered it as kind of my long-time career. But also what was happening around that time was I was getting very, very interested in the sciences. I always loved chemistry, loved biology. I wanted to get into a profession where I could use some of that, but not necessarily be like stuck, inside a lab. And so that's when I started thinking about medicine. So when I ended up in college, I went into pre-med, and that kind of launched my medical career. Towards the end of high school, I started applying for university, for college. And I wanted to apply early. At that point in time, it was called, I believe it was called Early Action. Fast forward several months later, we're actually in school, in class. All of a sudden, one of the counselors knocks on the door. And she says, "Alex, I have a message from your father." And I was like, what's going on? I hope everything's okay. And then she says, "You got accepted into Princeton," and the whole class erupted. It was actually pretty incredible. Everyone was super happy for me, clapping and everything else. Truly great surprise. About a couple weeks later or so, I got my Harvard acceptance. That became a little bit of a difficult decision because two of my best friends ended up going to Harvard. But I still felt that Princeton was going to be the right fit for me, and I decided that that's where I wanted to go. I knew I wanted to be a surgeon. I love the fact that you can work with your mind and work with your hands to be able to do procedures. But I wasn't sure exactly what field of surgery I was going to go into. When you do your general surgery residency, you rotate through all the different specialties, whether it's vascular, cardiac, general surgery. And one of the ones that we rotated through was plastic surgery. I realized that most surgical specialties are about removing the offending organ or removing the tumor. And in essence, they're essentially destroying something. And of course, destroying it with a purpose to allow that person to then continue to live. But plastic surgery is essentially the only one where you're putting things back together again. You're restoring form and function. And that's what really attracted me to plastic surgery. You're able to do that in adults and children from head to toe. You're not, just defined by a single organ, and you're trying to put things back together so that person can then not only simply live, but live well.
Pure started conceptually while Alex was in residency at Duke. He was developing his skills as a plastic surgeon, thinking about how he could apply everything that he learned in the real world. At that point, there were different career paths that he could take: an academic career path or private practice or joining another practice. And I think his drive and his grit really took him in the direction of private practice and what that would look like.
I decided to go into private practice and to open Pure so that my vision of how to, treat patients and how to care for patients could really come alive. And so our philosophy is that, yes, we're doing aesthetic procedures, and this really brings back a sense of self-confidence to the patients, and we've got to do it in a way where that patient doesn't feel like they're, just a number, but they feel like they're very, very unique and essentially, a part of our community, our pure community, and our pure family. Of course, work and the clinic and our patients are incredibly important, but it's also important to balance that with dedicating some time to myself and my health, as well as my family. In terms of my health, I don't have a lot of time, but whatever time I do have, I like to typically be outside, and that's why riding the bicycle is such a great sport. It allows me to stay healthy, while at the same time enjoying, the beautiful scenes here in Miami. And then, people always ask, why do you get up so early? And really part of that reason is also because I want to make sure that I'm home for dinner. Again, the dinner time is incredibly important. I want to spend that time with my family and dedicate some time to our kids and make sure that we're involved in their lives as well. Most of the time off that we have, I like to spend with either my family or Mikele's family. And that's a common theme that you'll see, within our lives. It's incredibly important for us. It's incredibly important to stay connected and to see, of course, our parents or uncles, or we want the kids to have good relationships with their cousins. Because at the end of the day, that's what's truly, truly important. So I want to show you guys a few things that kind of mark some of the most important things in my life. And here you can see a couple photos of little Alex, one of the early summers that we spent in Puerto Rico. There's my dad, Big Frank, my mom, Kari, brother Mike, and my little sister, Steph. This is that beach right there. It's early days of Alex and Mikele. That's probably about junior year in college. Here's my medal participation for the Pan Am Games in 1995. The government from Argentina actually gave me this beautiful knife as a token of appreciation. Here's our kind of our certificate of participation and in the participation medal for the 1996 Summer Atlanta Olympic Games. And though I talk about the horses a lot, we don't often get to see them, but here are the most important horses in my life. Unfortunately, they've all passed away now. But same old song is a horse that we took to the Olympics. But actually, probably my favorite horse was this guy right here. His name is Yavari. Beautiful, beautiful horse there. And then we had Xena there, the warrior princess. This is my Princeton badge. So Princeton was 1995 through 98. So this was my entire med school class at NYU, which is approximately 150 or so students. So Duke was kind of the last step in terms of my training and education. And one of the nicest things that they gave us during that graduation is that they gave us this Duke basketball, and it was signed by all the other plastic surgery residents and fellows there and all the other attendings there, with some, really truly inspiring and beautiful messages. So I'm going to share that for the rest of my life. In order to get to, say, the pinnacle of your sport or the pinnacle of your career, to try to achieve these goals, it does take, a lot of dedication and perseverance and grit, basically. It's a lot of hard work. What does grit mean for me? So it's not just about drive and hard work and dedication, but one of the most important components of grit is what I like to call deliberate practice. That means practice with a purpose, whether it's a sport or a career, surgery, or anything that you're doing. And it's dedicating yourself to hours and hours of deliberate practice that will eventually lead you to become a master. I still get up at 5 a.m. To go into the office every single day. And that's, no one's telling me to do that. We're in private practice now, but we still want to dedicate our all to our practice and to our patients. And similarly, with the riding, 6 days a week, 2 to 3 hours a day. And then, of course, throughout the very, very long years of our medical career, which was, of course, was med school, general surgery, research, and plastic surgery training, where I would be working easily 100, 120 hours a week. Of course, in order to do that, not only do you need your self-drive and your passion and everything else that we just talked about, but you need a lot of support. No one can do it alone. So you need support from your family, the family that I was born into, my parents, my siblings, and then the family that we created with my wife and our kids.
You know, we've been together for 25 years. We've gone through college, medical school, residency, training, and all kinds of things together. And I think what held us together this whole entire time is that we both share this value of doing what's right. And doing what's right can mean different things to different people. But to us, it was doing what's right for each other, doing what's right for our families, holding our families really close to our heart, and understanding that what's happening right in front of us at that moment isn't what's going to happen forever. And that what's most important is that whatever comes our way, we're doing it together.
I would have never been able to get to the place I am without having Mikele at my side. We met all the way back as sophomores in college. So she has been there with me pretty much every single step of the way.
It's been a really gratifying journey, but definitely not an easy journey. Yes, it's been a bumpy road. I had 3 kids under the age of 2. My husband was working 120-hour weeks. I had twins. I was changing 2 sets of diapers at the same time and breastfeeding 2 children at the same time while, walking a toddler. So yes, there was times when it was really challenging, and there was times where I really had to dig deep into my own grit to get through those moments. But I think really what ends up mattering at the end of the day is that for us, family is the most important thing, and being supportive of each other is super important, and is what keeps us together at the end of the day. I'm incredibly proud of my children, to be honest with you. Haven't taken that time to really be a mom full-time when they were young has really paid off. Our kids are 13 and 12 now, and they have an excellent moral compass. And I couldn't be prouder of seeing them, how they can make decisions about who they want to be with, who they want to be as people, and just having the maturity to really have that moral compass guide them through in their day-to-day decisions. My vision for the future of Pure is that we can continue to express our values through the practice. I want our patients to feel like they come to a place that feels like home, that they're being treated like family. And I want our staff to really feel supported and rewarded because they work hard every single day and they give their all. And when they do that, they really should be rewarded and they really should be supported. I'm excited for what's to come. I'm excited for the future of Pure. I'm excited that we're growing. And I'm excited that we are really able to transmit our values through our practice and that people are seeing that and it's resonating with them. And I'm excited for the future. I'm looking forward to it.
One of my favorite things to do is grilling, and I love to do that out here in what I call my sanctuary. This is my outdoor kitchen, Earle's Delirium Trim and Bar. And one of the keys to grilling is actually not so much, fancy rubs or sauces, but really starting with a great quality meat. So here we have beautiful Wagyu tomahawk steak. Okay, I do like to use this kind of kosher refined salt. So you want to be pretty liberal with the salt. You can get some along the bone as well. But we're going to be cooking a very kind of traditional parrillada here. We're going to accompany that with some chorizo, all right? And also what's called sweetbread. Once everything's been seasoned, we just kind of let it sit there for a little while and we go to our Uruguayan style parrilla here. All right, and so we have everything on the grill cooking nicely. Of course, you got to accompany it, and there's nothing better than a great bourbon. I think Mikele and I, we actually create a really great team. We definitely have our strengths and our weaknesses, and turns out that my weaknesses tend to be her strengths and vice versa. So, I like to dedicate a lot of my time to the actual patient care, so taking care of our patients, the surgeries themselves, making sure that the patients are doing everything they need to do in order to recover well and to optimize their outcomes.
I agree. I mean, I think he's great with the patients. He loves being in the OR. And just as much as he loves that, I love looking at reports, and I love making sure that our staff is supported and troubleshooting and fixing problems and just thinking about what's next in terms of the administrative or business side of things.
I have a very clear vision of when I'm executing, for example, a surgical plan, but also, have big ideas, sometimes creative, ideas. And that part of it, I am not quite sure sometimes how to execute that. So, I've done many, many years of medical training, but of course, no business training. And so Mikele she has her MBA. She's worked and created other businesses, whether they're nonprofits or for-profit businesses. So that skill set really does come in. And basically, it's a synergy in terms of our strengths to really try to create pure, basically the best practice that we can for our patients.
Thank you for joining us today.
I hope you enjoyed it. I hope you got to know us a little bit better, and we look forward to seeing all of you at Pure Plastic Surgery.